It is a common thought among fresh dental students or fresh graduates or who has just stepped into their clinical phase that nerve block in dentistry is only the inferior alveolar nerve block, and only infiltration or supraperiosteal injection is the only anesthesia technique in the maxilla. But this is not so. If you have watched my previous videos, there are numerous types of nerve blocks in the mandible, and same is true about the maxilla. There are also some extraoral technique of nerve blocks. The types of nerve blocks in maxilla are maxillary nerve block, posterior superior alveolar nerve block, middle superior alveolar nerve block, anterior superior alveolar nerve block, which is also called infraorbital nerve block, greater palatine nerve block, nasopalatine nerve block, and few more. And of course, there are some injection techniques like buccal and palatal infiltrations, PDL injections, and so on. Posterior superior alveolar nerve block is preferred to local infiltration in situations like procedures involving multiple teeth or when local infiltration is not successful due to some reasons like local infection or inflammation. The technique of this nerve block is very simple. We just have to remember few common landmarks like mucobuccal fold adjacent to the maxillary second molar, maxillary tuberosity, and zygomatic process of the maxilla. What you have to do is always follow the basic steps. Starting with taking a sterile long needle of diameter about 27 gauge. Warm the anesthesia cartridge and check the needle flow, then position the patient preferably supine or semi-supine and prepare the site of infection by drying, applying antiseptic and topical anesthetic if available. Ask the patient to partially open the mouth, retract the cheek and soft tissues to make them taut and identify the landmarks like mucobuccal fold and maxillotuberosity. The bevel of your needle should be directed towards the bone and insert the needle at the height of mucobuccal fold in the second molar region. Slowly advance the needle superiorly, medially and posteriorly, making 25-degree angle with the upper occlusal plane and long axis of the upper second molar. The depth of the needle should be up to 16 mm in a normal average size person, and the final position should be posterior, superior and medial to the maxillary tuberosity where the posterior superior alveolar nerve exists. Aspirate in two planes and then deposit one cartridge of local anesthesia over 1 minute and then wait for a few minutes for the injection to get effect. Posterior superior alveolar nerve is a branch of maxillary division of trigeminal nerve. It divides from the maxillary nerve in the pterygopalatine fossa and then after going downwards and forward it emerges from the pterygomaxillar fissure and enters posterior superior alveolar foramen from where it has branches to the posterior teeth. Pterygoid venous plexus and maxillary artery is located in the infratemporal space between the lateral and middle pterygoid muscle and temporalis muscle just above the posterior superior alveolar nerve. During the posterior superior alveolar nerve block, the injection presses the mucosal submucosal loose tissue in the infratemporal space and targets the area posterior, medial and superior to the maxillary tuberosity just before posterior superior alveolar nerve enters the posterior superior alveolar foramen anteriorly. Posterior superior alveolar nerve block and its branches are anesthetized which supply the maxillary first, second and third molars except the mesobuccal root of first molar in some cases and buccal periodontium and the bone overlying these teeth. During this block technique, no bone is contacted. If that occurs, the angle of the needle is more medially. In that case, withdraw the needle and then correct the angle. We also have to be careful regarding the depth of the insertion of the needle and location of the needle tip to avoid hematoma formation from puncturing the pterygoid venous plexus and maxillary artery or failure, and also to avoid mandibular anesthesia, which is the result of needle located too laterally as mandible division is located lateral to the posterior superior alveolar nerve bar. Posterior superior alveolar nerve block, if performed correctly, is an atraumatic and painless nerve block with minimum number of injections compared to infiltration and have high success rate. So go on practice posterior superior alveolar nerve block as much as possible when required and always apply anatomy. That way you will be able to avoid complications and failures. Good luck.